This is episode 116 of Off Script with Trish Close, intimate interviews with interesting people. Joining me today via Skype, I have Nicolette Lewis-Saint, the Executive Director of Healthcare Ready. Hello, Nicolette.
Hello, great to be with you.
Well, great to have you. Thank you so much for doing this. I'm really excited to pick your brain and get all of the good stuff, all of the advice for my community here. Before we get into all of that, talk to me a little bit about Healthcare Ready. What is that?
Sure. So Healthcare Ready is a national nonprofit organization that was stood up to serve as a public-private partnership right after Katrina. So our focus has been, since that mandate, really making sure that we are doing the coordination between the public and private sectors, partners in the healthcare industry, those who are what we would consider the dispensers, so pharmacists and providers, to make sure that they have a conduit to be able to coordinate directly with our partners in government at the federal, state, and local levels, and that we are focusing most acutely on the needs of those who will see disparate impacts after a disaster, those who have challenges getting access to care, need to get their chronic care medications refilled. Before the conversation of equity in disasters was even a term of art, the organization was really stood up to make sure that we are doing the work of serving those who need us the most during a crisis where most of their core abilities are disrupted.
That's a common theme in some of the experts that I've talked to with disaster preparedness. It sounds like we should be prepared for all of this months ago.
Yes.
Right?
Yes, very much so. I think one of the things about disaster preparedness in general is that it's often difficult to get the general society and sometimes even, policymakers and businesses to think about what might happen when they're focused on the immediate and the today. And they're saying, you're asking me to prepare for something. It's not really certain. It may happen, it may not in my lifetime, but you're asking me to prepare.
Yeah.
And our challenge with preparedness is that it really has to happen well before the actual event.
I feel like sometimes our brain doesn't go there, right? We don't want to think about having to pack a go bag and just have it sit somewhere. Like it doesn't make sense to us, but it has to start, right? We have to start thinking that way.
Absolutely. I mean, it's scary. It's scary to think about, the scenarios that often would make a great movie. They're the things that we think about as like the movies we watch. And, we think about like the catastrophic earthquake or the disease outbreak that shuts down society or whatever. Well, thinking about what that actually looks like in your family and what that looks like for your community to be able to withstand, that is scary. And in the midst of a lot of other realities, it can be hard to want to focus on that. But, that go bag really, it's a single thing to do, but it's the minimum that we should be doing to think about how we prepare.
And it could ultimately be your lifeline in a
Absolutely.
disaster. I do want to talk about Katrina, and just so you sort of know our situation here in Southern Oregon. As up and down the West Coast, we've seen devastating wildfires. It's at the time of this, when this goes up live, this interview, it'll be about a month that we've seen the Alameda fire. There's another fire here locally, but it just ripped through a couple local towns, destroying thousands of homes and businesses and displacing all of those people. So in my effort to just help my community, I'm thinking, what can I do? And it's to talk to wonderful, intelligent, brilliant people like yourself. Going back to Katrina, I interviewed Daniel Aldrich from Northeastern University. He's a Katrina survivor. And he essentially said after that, he was looking for that white horse, that, FEMA, and he was looking for the Salvation Army, the Red Cross, to come to his rescue, and he didn't find that. Was it really Katrina that sort of flipped the switch for all of us and kind of woke up all of these people like, hey, there's a lot that's not going right? Was it Katrina that did that?
I think for modern history, I think Katrina, 9/11, and Sandy, if you think about those as three different events, kind of shook different parts of the system. But I think Katrina was the event that really showed what it looks like when emergency management is not prepared to meet the immediate needs of people, and what it looks like to be in a situation where the needs are so overwhelming and there is no cohesive strategy to get it done. And so I think that is true. Also, though, if you think about the world prior to Katrina, 1995 maybe to 2005, we really were quiet. There were some catastrophic hurricanes. A lot of them actually spared the Gulf states and actually impacted the Caribbean more. But there was Andrew and George, and there were some other storms that really did impact the Oklahoma City bombing. You had events, but you didn't have events that actually ripped at the core of some of the inequities the way that Katrina did and really exposed what it takes to be able to mount a full-scale government response to meet that type of range of needs and address the disparities that were being exposed.
That's interesting. 95 to 2005. Those were the good old days. Can we go back there? Please, can
It's
we
so
go
funny.
can we go back there where we were wearing chokers and watching Beverly Hills 90210?
Exactly, right? Our biggest problem was what was going to be in the TGIF rotation on ABC on a Friday night, It was a good time.
It was. Oh, that just makes me a little sad. Talk about the levels of government. We're seeing that here because we have FEMA on the ground here. And so we're hearing like residents going, whose responsibility is it to clean up? Is it mine? Is it counties? Is it the state? Is FEMA going to help? So that was that a huge challenge after Katrina, getting all of these levels of government to kind of line up and talk to each other?
I think part of it is there's a premise of how emergency management works, which is that things are always locally controlled, and we are supporting our partners in Oregon and tracking the health needs very closely. And so our hearts, but more importantly, our work is with you all right now. Um, what we see is that locally controlled means different things to different agencies, to different political leaders, to different policymakers. And so the premise is that the local government is always in control. So whose job is it? If it's your personal property, it's your job to clean up. But if you need assistance, that first line of assistance should be coming from those local organizations, that local emergency management, the fire departments. That's where the local assistance comes in. The concept is that when the local authorities, the mayor, county, commissioner, whomever, determines that the need outweighs their local capacity to support, then the state kicks in.
Gotcha.
And the state's job is to make sure that as they assess the ongoing needs, especially if it's happening in multiple counties, like what we're seeing in Oregon, like what we're seeing in California, it's more than one county. So the state has to have a very, very active level of control and also be prepared to request federal assistance. And that federal assistance may come in the form of money. It may just be that more money is needed to be able to pay for trash removal, pay for cleanup, pay for overtime for additional staff. But it may also be that personnel are needed to have people on the ground to assist with public assistance applications and to help people to understand what types of programs might be available to them as they are recovering from the disaster, and funds can be made available, and also doing the hard work of helping with the coordination, doing all of that field work. And so the idea is the hierarchy is almost reversed in a disaster, so that local is always in charge and that the states and the feds are working in service to the locals. But that doesn't mean that the responsibility is only at the local
Got you.
level.
That's how it should be, though, right?
Right.
Yeah.
Right.
Was it always?
And I think the idea. Oh, go ahead.
No, I
Sorry.
was.
I just wanted to make one quick point. I'm sorry. The idea really within emergency management is that local leaders should know their community best. And so that's the reason you say locals stay in charge, because if you say we're going to put this truck over here, or we're going to set up assistance here, and people don't go to that part of the community, or that's not where the actual need is, that's why you want locals in charge. But that doesn't always seem to happen.
Right. And that's what Daniel was mentioning to me, that really, the folks from FEMA that are on the ground really need to be talking to the local leaders to make sure we're all in sync, because we don't want, especially when it comes to rebuilding, we don't want someone from the outside coming in going, this is how it should be built, when we know our community best.
Exactly. And I think that is a lesson from Katrina. If you think about everything from, okay, you're going to move people, to the Superdome, or you're going to move them to Houston. Well, how are they getting back? Someone who's a local community leader knows the answer to that, or thinking about what the recovery phase after wildfires looks like and which communities you need to prioritize for cleanup, because maybe those are central hubs for other members of the community. And if you can have certain communities prioritized for cleanup, you can push more resources there, which allow for people to have easier access to those resources. A Fed is not going to know that.
Right.
And so that's the idea, but it also requires that there's a human element that we get past, which is that egos have to be put aside, people have to be willing to talk to each other, and there's no process or system that's going to get around that.
Oh, there's the challenge. The E word, ego. Looking at, I wanted to talk about the Ebola epidemic of 2014. You played a pretty big role in that. Talk to me about that.
Sure. So during the Ebola crisis, if you recall, there was a projection that came out from the CDC round about June of 2014 as the outbreak was starting that said, if we do nothing, we will lose 1 million lives by January. And it was because that disease outbreak, you're talking about an outbreak that's so infectious. And not only are people infectious, but they are most infectious after they've died. So at the point where culturally normal funeral rites and things of that nature would happen, you can have 500 people infected from a single dead body.
Whoa.
Yes. So it's because at that point, all of your fluids are completely filled with Ebola virus, your tears, everything. And so in the process of preparing someone for a funeral, that's how we were seeing these high rates of transmission. And so our recognition was that a disease outbreak anywhere is a threat to the entire globe. There's no such thing as having an epidemic in one corner of the world that's not going to be a threat for anyone else. And we needed to mobilize a global community. And so a part of my job was really working with the State Department's leadership to make sure that we were doing our part to support the WHO, making sure that they had what they needed, because the WHO really wasn't set up at that time to be, the epidemiologist to the world and to be in the actual trenches doing that level of disaster work. They needed money, they needed resources, but we needed to get the global community on board to recognize that this is a global threat, which meant healthcare workers going to West Africa. It meant funding being able to support those countries as well as the WHO. It also meant that we needed to share information and do a lot of coordination, because science was happening in many of those countries, and we needed to be able to exchange that as well. So that was a part of my role in the response.
Man, it's setting you up for 2020.
Tell me about it.
Good grief. In 2019, you were appointed to serve on, and correct me, Baltimore Sustainability Commission within FEMA.
So I got 2 appointments. Within FEMA, the National Advisory Council, which is known as the NAC.
Yes.
And then within Baltimore City, where I live, I would serve on the Baltimore Sustainability Commission.
Okay. So in those 2 roles, what work do you, or I guess, yeah, what is your involvement with that?
Sure. So with Baltimore, so one of the things that I actually love about the way that Baltimore has thought about planning and urban planning is that they've taken on sustainability and recognized that as a mid-Atlantic, a city in a mid-Atlantic state, while they are often spared from some of the catastrophic events, they recognize that things are changing, and being spared means that you're lucky more than being right. And so they've actually incorporated their sustainability plan into their urban development plan for the city. And so as a commissioner, my job is to work with other commissioners as well as the Department of Planning and local elected officials, so that we are discussing how to actually implement the plan, being able to give objective feedback as a citizen and as a commissioner on proposed plans, making sure that there is engagement of members of the community across the 200 plus neighborhoods in Baltimore, so that there is actual feedback that's coming in before things are decided. So that's a big part of my job there. With FEMA and the National Advisory Council, That's been it's been quite a wonderful experience because we get charges from the administrator, and so my job is as a public health representative on the council. And the administrator this year gave us three charges. One was on the vision for what FEMA should be. The other was the capacity that FEMA needed to have to meet the threats of our lifetime,
Hmm.
if you could imagine, you know. And
Right.
the other was on equity. And so our job has been working together not to look at FEMA or the world as it is, but really to build out recommendations as objective, third party, engaged participants to say, this is what we think it should be. This is how we think we need to get to where we envision the needs being in the coming years, months, sometimes based on the way that things are going right now.
Yeah.
And these are the recommendations that we are charging the administrator to take up and consider to think about ways to transform this agency to be what the nation needs.
Wow, that's kind of fun. You're like the boss.
It is. I don't know. I feel like I work for more people than I ever have. But it was very interesting to get those charges though,
Hmm.
because back in January, if you can even remember such a time, we all were so excited about this year. We
I
thought it was
know.
full of promise and possibility, and 2020 could only bring good things, and we could have time to vision and plan and strategize. And to get a charge like think about the capacity that emergency management needs
Hmm.
at the top of 2020,
Hmm.
who would have known that
Right.
we would have actually had to use all of that capacity just a few months later?
My husband has this theory. I think a lot of people have this theory actually. 2020 is that idea of clarity, you
Hmm.
know, as far as your vision. And so looking back, it really is an opportunity to take a look at what's important in life. Everything becomes kind of clear on what really matters in this world.
Absolutely.
So I don't know. I kind of am with him there. So I'm thinking we're going to learn some lessons. We better learn some lessons from 2020, right?
Absolutely.
I want to talk about recovery and those immediate needs for people. And I've been trying to put myself in those who've lost everything, everything. So all of their memories, but even, and you can probably definitely speak on the fact that if you have medication, you don't have, it's all burned in this fire, all of your clothes, all of your documents and records, all of these things are now gone. The immediate need is just to survive, I'm assuming.
Right.
Beyond that, it's kind of like a now what? We're 3 weeks, a month in. Now what?
Yeah. And I think that's why, so one thing you'll hear emergency managers say, and I'd be shocked if my colleagues who were on previously haven't said it. If you've seen one disaster, you've seen one disaster. And it's important to remember that because, wildfires in particular, we've seen wildfires that have literally demolished one side of a block and left the other side
Yep.
spared.
Yep.
You've never seen anything like that, right? And so when you're thinking about even how we tell people to prepare, many of those actions may not help in a wildfire situation because having a go bag near your door, you may not have been able to pick it up, right? That's practical. Having a fireproof safe, that's about the only thing that really might have survived such a situation. And so, of course, the first focus is survival. I know there are some programs that are being stood up. There are resources. So one that I always like to lift up is OnStar for people who are in their cars. If you're thinking about it, if you've successfully been able to evacuate, you might still have your car. You may not have your home. And so OnStar actually has tremendous resources to help people who are navigating a disaster. You press that button and they are using all of their resources to figure out how to help you meet your needs. Pharmacies are prepared to be able to do whatever they can. If are in need of a prescription refill, they can try to do everything they can to pull up records and give you a free emergency refill. Those are some of the things that state regulations allow for during an emergency, but that's a critical part of how we're able to make sure that those needs are met because it's not feasible to expect that someone just has everything on hand, right? They've escaped with their lives, and thank God their lives have been spared. But now the rest of the system has to make sure that they have their remaining needs met. And so those are the types of programs that are in place. And I think it's important that we make it as easy for people to navigate those as possible, because it's all so overwhelming.
So overwhelming, so overwhelming. And we're hearing, there's always critics. We're hearing critics say, well, FEMA's great in a hurricane. FEMA, if this was a hurricane here, they would be on the ground and everything would be fine. Wildfires like the redheaded stepchild of disasters. Is there any truth in that?
I think if you ask a hurricane survivor, they might tell you something different as well. I think it's different. There's some hazards that we've had more practice in. And I think from that vantage point, there's been a lot more, coordination on hurricanes over the last 20 years, sure. But if you look at the last 3 years, every single year since 2017, maybe 2016, there's been historic wildfires. So it's not that they're not practiced. It's that the systems have to be designed to be able to help people in a way that's a lot more easy, and can be a lot more complete. And when you're thinking about, the one thing that is similar between wildfires and hurricanes, if your home is destroyed, your loss of records are actually one of your biggest challenges after an event, because you're in a situation where you might think, okay, as long as I have my license, I'm fine. But what if you don't?
Right.
What if you have to get your Social Security card again? What if you need your immigration papers, right? So thinking about, those things, that's not something that FEMA is necessarily equipped to do. If you have those pieces in place, they can process you a lot quicker. But if you can't find your deed to your home, which is possible after a hurricane or a fire, then a lot of the programs that are available can't be made available to you.
And that's where, in asking you this question, who then helps these people out? Is it the community? Is it local state government? Is it FEMA? Is it all of us?
It's all of us. It's all of us. And I think that's the responsibility mandate. Sometimes it's difficult when we say all of us, because some people hear that and think none of us. But the reality is, it is truly all of us. It does require all hands on deck, because every situation is going to be different. Every household may have a different set of needs or a different set of priorities. And so it does require that the local government is prepared to do everything that they can, and that community organizations have the resources that they can to assist, and that national organizations actually work with the community organizations to hear what's needed and work quickly to meet that need. And that FEMA, as the federal entity, does their part and helps to expedite. It really does take all of us.
Yeah. And that is overwhelming just in itself. Like, here I'm thinking, okay, it's all of us. What can I do? Is it something as simple as, offering someone my computer to say, here, do you need a few hours with my computer? Or, hey, there's a resource center that you can go to. Go there. They'll help you figure out all this paperwork.
It could be as simple as that. It could be making sure that for every website of a legitimate resource that you can identify, there's a phone number, because to your point, not everyone might have their computer anymore, and it might be easier for them to call than to try to navigate a website. It can be helping people to think about the fastest way to get critical documents. Again, they may need stamps. It's basic things like, what happens if you just need to mail out a bunch of forms? You need stamps, you need envelopes. So where do they find these things? So it's anything that can really make someone's life easier. And especially for those individuals who may be older, may have visual impairments, there are a lot of forms right now that individuals may have to fill out in order to have some sort of assistance or restoration that are not exactly friendly if you have a visual impairment. And if you've had your glasses or whatever assistive devices you've had destroyed, you may need help. So you helping may be being at a safe distance with a mask on, because it's still COVID, and helping them to read the form and filling it out on their behalf.
Okay, that's an interesting point for sure. We just ran a story yesterday about a donation center, because I'm also talking from you brilliant people, that while donations come in super fast, and that's great, a lot of times it's the wrong thing that we're getting here as a
Yes.
community.
Yes.
So I said to my reporter, I said, that's what we need to do a story on. People wanting to give is great, but you have to give the right thing. And so specifically asking, hey, donation center, what do you need? And one of the things they said was luggage. So people don't have to carry around all of these donations in a trash bag.
Yes.
And I,
And you know, I don't know if anyone mentioned this, but we call donations the third disaster.
yes, it's so true. It's so true. I've just been doing research on, I think it was Daniel mentioned the tsunami maybe in 2014, or no, 2004, I think, and I want to say it was in Sri Lanka. I may be wrong on that, but he was saying tropical climate, and they were getting a massive donations of sweaters that then they just had to throw away. So yeah, I mean, I've been harping on donations. It's been my soapbox for sure, but it's just, we can't, first of all, we have to pace ourselves for these victims, and then also we have to make sure they're getting the right thing.
Absolutely. So what we often tell people is that if you want to donate things, don't. And the reason is, unless you are, to your point, in direct communication with either a family who's prepared to directly receive it, or hearing from the individuals who are doing that coordination about the specific things they need, and you are prepared to go out and purchase something that is new, or you have something in your home that is new or like new, chances are the amount of work that it's going to take to get that piece of luggage that's been sitting around and is dusty because it's been in your attic for 15 years to a level where it would be appropriate to use for someone else actually would be more work than someone just running to the local pick your big box store and just buying luggage. So often giving cash to a trusted entity can get you further. The other thing, though, is that oftentimes people use disasters as an opportunity to clean their closets. And so you hear, and that's part of the reason that it becomes this massive logistics operation, because people will donate things. We had this after Maria. We had this after Harvey. You have to end up getting literally warehouse space so that we can have staff go through and comb through all of this stuff, because there's so much stuff and most of it's not usable.
It's crap.
So you just, again, it's all garbage. It's all garbage. But if you're thinking about it from the vantage point of wanting to help and thinking about it from a place of compassion, consider that if you were in that situation, would you want someone's dusty 20-year-old luggage that has broken zippers that you can't use? Because at that point, that's as demeaning as the trash bag. That's as, dehumanizing as someone having to walk around with their life effects in a trash bag. So that, to me, is a part of it, is using that compassion and understanding that when we donate, the best thing to do is donate exactly what's asked in the best possible condition that we can get it in.
Right. And I would suggest, too, if those people are like, well, I can't donate cash, then maybe you could donate your time and go to a center and just say, hey, put me to work.
Sure. And even if you're at a distance, one thing that we've really seen is that social media has been a great tool for people. And some of what we've seen has been actually, I remember, maybe during Hurricane Harvey, there was a partner that we had that was based out in Minnesota. And she was at our home, and what she did was she mobilized members of her community and her network to say, we're going to comb through social media platforms, and if we hear people with a demonstrated need, or we can actually find people who have legitimate offers, we're going to make sure we collect those and share those with the people who we know can actually help. So that, that doesn't cost money, but if you're scrolling and you see somebody talking about having a need, making sure that you amplify that and helping them to get that assistance, that doesn't cost money, but that goes a long way.
Absolutely. Being that connection, right? So, oh, you need this, I can put you in touch with this person that can help you out. Connection.
Exactly.
And that's huge right now, especially, after post-disaster, we absolutely still have to be connected as a community.
For sure. And I think often especially during COVID, we have a tendency to want to rush in, but doing that safely is important. So making sure that we are doing everything we can from a distance is a critical part of how we take care of ourselves and each other.
Yeah. Yes, 100%. Are there any stories from, disasters in the last few years where you were put in a position where you're watching all of this happen and you're like, this needs to change. This needs to change. Too many to
Every
name?
day. Every day. Gosh. So, gosh. I'll take Harvey.
Okay.
2017, when it's so crazy to think about 2017. It
I know.
feels like it was an actual lifetime ago.
Hmm.
But when you think about the way that the storms happened, you had Harvey and all of the resources flooded to the Texas, Louisiana region to make sure that we were doing everything we could to assist. But as soon as you had those 6 days of rain, because Harvey was a rain event that it actually sunk the ground.
Yep.
There was so much rain that it actually impacted like the ground
Hmm.
level. So you had that event, and then shortly after you had Irma. And when I say shortly after, we're talking about within 2 weeks, there was another storm.
Right.
And then within 2 weeks, another storm. And so what we saw was all of the attention and the resources and the focus that was in Texas went to Florida. And then everything went from Florida to Puerto Rico. And in the process, what happens to Texas when you're focused on Puerto Rico?
Hmm.
What happens to Louisiana when you're focused on Florida? What happens to the US Virgin Islands? And to me, that's something that's always stuck with me is the one thing that has to change is we can't all be looking at the same place at the same time because we're not in a world anymore where one thing is happening at a time.
Right.
So it can't just be that we focus on, oh, and by the way, 2017, catastrophic wildfires were going on at the same time as catastrophic hurricanes,
Yep.
right? So we can't just look at one thing, and that does have to change. How we build up an emergency management system that allows for us to really be focused on 5 or 6 disasters at a time is going to be critical to our survival.
Man. And looking at, Jeff Slegelmich, I told you this, said you are one of his favorite people in a disaster space, that you can provide practical advice. For those listening who really need that practical advice right now, what is that from you, Nicolette? What is that practical advice that we can take home today?
First and foremost, I would say making sure that you are taking care of yourself and your family. We have a tendency to want to take care of others, but especially in the middle of a pandemic and catastrophic wildfires and one of the most hectic years that some of us have ever seen or could have ever imagined, making sure that we're taking care of ourselves first and foremost is important. And that will look different for different people. But a big part of that is making sure that you're taking care of your health. And so if you can't tend to your health, you really need to make sure that you are getting that squared away before you try to help others. Making sure that you have the prescription medicines that you need. There are a range of programs that can help you afford those medicines at this time. If you can't afford them, having an extra, making sure you have that extra refill on hand so that if you have to evacuate, you have your medicines, making sure that you have that list of your medical needs and your families on hand. Keep it in your car, keep it in a Ziploc bag in your trunk. Those kinds of things are really important. And then if you can make sure that your wellness is taken care of, listening to your community, listening to folks, because if you listen, people will tell you what they need. But I always encourage, before we rush to act, we have to first listen and make sure that we're acting in a way that's in alignment with what people tell us that they need.
Yeah, take that breath after
Right.
this and then kind of, okay, this is what people need. This is what our community needs. Take that breath.
Definitely.
Okay. Thank you so much. I so appreciate your work. I feel like you're spotting the gaps and the holes and trying to fill them in.
Thank you. No, I really appreciate that. And I may take that line and use it because I think it's probably the best definition of what I do every day that I've ever heard.
I'm
So
just trying to
thank
fill
you.
the gap. Just trying to fill the gap. You're my third expert that I've interviewed in the world of disaster preparedness and recovery and the aftermath. And it's really opened my eyes in a sad way, I think, to go, this is so bigger than I ever thought. And as a journalist, I've reported on disasters and hurricanes in other parts of the world, and never, ever thought I would see it in my own backyard, and here I am.
Absolutely. And thank you for doing this because it's also really important to make sure that we're talking about these issues and that we're doing it in a way that is both approachable and a little bit less scary, but also practical so that people are preparing before it could be them. So thank you for the work that you're doing as well.
Yeah, and Daniel even said that too. You know, the idea that you're not alone going through this is huge. That idea that you're all alone is absolutely horrible. So if you have this idea that, hey, my neighbor is going through the exact same thing I do, what a weight off your shoulders.
Absolutely. Disasters can be isolating for sure. And reminding people that they are not alone and reminding them that being able to have that, Daniel always talks about social cohesion, that interconnectedness, that ability for us to make sure that we're not accidentally leaving people behind and that we're not losing that fabric of a community because we've suffered a disaster. And that's what gets people through. So making sure that we are having these conversations and that we're opening those conversations up, not just to the disaster experts, but really to everyone, helps to deal with that sense of isolation that these events can cause.
1,000%. All right, Nicolette Lewis-Saint, I'm going to let you go. I've gobbled up enough of your time. Thank you so much. If you are listening to this podcast on Apple's podcast app or Spotify, please subscribe, rate, review. It helps other people find us. You can also watch it at ktvl.com and on YouTube. Just search Off Script with Trish Close. One more time, Nicolette Lewis-Saint, the Executive Director of Healthcare Ready. Thank you so much for sharing your knowledge and your guidance with me today.
Thank you. Take care and be safe.